Anxiety is your body's natural response to stress. It's a feeling of fear or apprehension about what's to come. The first day of school, going to a job interview, or giving a speech may cause most people to feel fearful and nervous. But if your feelings of anxiety are extreme, last for longer than 6 months, and are interfering with your life, you may have an anxiety disorder. It's normal to feel anxious about moving to a new place, starting a new job, or taking a test. This type of anxiety is unpleasant, but it may motivate you to work harder and to do a better job. Ordinary anxiety is a feeling that comes and goes, but does not interfere with your everyday life. In the case of an anxiety disorder, the feeling of fear may be with you all the time. It is intense and sometimes debilitating. This type of anxiety may cause you to stop doing things you enjoy. In extreme cases, it may prevent you from entering an elevator, crossing the street, or even leaving your home. If left untreated, the anxiety will keep getting worse. Anxiety disorders are the most common form of emotional disorder and can affect anyone at any age. According to the American Psychiatric Association, women are more likely than men to be diagnosed with an anxiety disorder. Researchers are not sure of the exact cause of anxiety, but it's likely a combination of factors play a role. These include genetic and environmental factors, as well as brain chemistry. In addition, researchers believe that the areas of the brain responsible for controlling fear may be impacted. Current research of anxiety is taking a deeper look at the parts of the brain that are involved with anxiety. If you have an anxiety disorder, you may also be depressed. While anxiety and depression can occur separately, it's not unusual for these two mental health disorders to happen together. Anxiety can be a symptom of clinical or major depression. Likewise, worsening symptoms of depression can be triggered by an anxiety disorder. Symptoms of both conditions can be managed with many of the same treatments: psychotherapy, medications, and lifestyle changes. Teenagers may have many reasons to be anxious. Tests, college visits, and first dates all pop up in these important years, but teenagers who feel anxious or experience symptoms of anxiety frequently may have an anxiety disorder. Symptoms of anxiety in teenagers may include nervousness, shyness, isolationist behaviors, and avoidance. Likewise, anxiety in teens may lead to unusual behaviors. They may act out, perform poorly in school, skip social events, and even engage in substance or alcohol use. For some teens, depression may accompany anxiety. Diagnosing both conditions is important so that treatment can address the underlying issues and help relieve symptoms. The most common treatments for anxiety in teenagers are talk therapy and medication. These treatments also help address depression symptoms. Anxiety disorders can be treated with medication, psychotherapy, or a combination of the two. Some people who have a mild anxiety disorder, or a fear of something they can easily avoid, decide to live with the condition and to not seek treatment. It's important to understand that anxiety disorders can be treated, even in severe cases. Although anxiety usually doesn't go away, you can learn to manage it and live a happy, healthy life. There will always be someone who loves you. Please just stay safe.